So when we see patients of different ages, I put them into categories again, right? So if it's a younger patient that Raymond has, I tend to think, okay, this is about beautification more than correction. In an older woman who's never had anything done before, it's a little bit more towards correction, little bit beautification, or sometimes it's just all correction before beautification. So I need you to keep that in mind, because if you look at her face, right, zoom in, if you look at her face, oh, are we still that one? If you look at her face, she's not very symmetrical. And when she's 48 years old with thick skin, it's very hard to achieve the symmetry. And as part of the consultation, I will explain that to the patient first, that we are not going to be getting perfect symmetry, because it's all about correcting some of the defects and deformities and make her look more youthful overall. So by septate, so septum, which means when you are injecting in this area, you must not inject any hyaluronic acid into the malar mount. If you accidentally inject hyaluronic acid into the malar mount, it's going to attract significant amount of water, and because it is demarcated by septum, it's not going to be able to expand, it will go up, and that will accentuate the appearance of the malar mount and make them look even more tired looking. Alright, so for the mid-phase, that's my priority, to try to soften the appearance of the malar mount, soften the appearance of tiredness, and try to achieve a lift. Then I move on to the lower 1/3 of the face. As you can see, there is this little pouch here, this little pouch here. She's undergone significant loss of volume in the lower 1/3. The chin is on the weaker side. Yes. One of the most challenging parts when it comes to rejuvenating the infraorbital hollows is trying to establish exactly where you are. Now, I would like the delegates to now visualize 4 different layers. Start from the top, you have the skin, subcutaneous fat, orbicularis oculi, and then you have the fat. Your target depth is the deep fat compartment, layer number 4. However, lift the corner of the mouth without adding too much volume. That's when it comes to controlling the plunger and the speed of withdrawal of the instrument comes into play. So it's not all about filling, it's all about the control of the instrument, right? Now, entry points. As I mentioned, this entry point is determined by 2 factors. So solving one problem, we can sometimes create another problem. There is just no perfect solution here. However, as a clinician, as I mentioned, I'm going to remember a few things. My objectives are, I want to soften the appearance